Welcome to the module on Prevention of Diarrhea and Key Messages for Diarrhea Control. By the end of this module, you will be able to explain diarrhea as a case, understand and reflect upon wash issues, make awareness on wash issues, state the hygienic factors, describe use of improved sanitation, know the issues and challenges in diarrhea prevention, control and treatment. Diarrhea kills 2,195 children every day, more than AIDS, malaria and measles combined. In this context, UNICEF, WHO, WGO, CDS and government-associated community-based organization, CBOs, are working towards diarrhea control in children under 5 years of age. Protecting children by establishing and promoting good health practices, treating children who are suffering from diarrhea with appropriate treatment, considering various living conditions and inappropriate practices followed in the society, children falling sick from diarrhea. To overcome with this situation, we have to ensure and implement the universal coverage of immunization and to adopt healthy environments. Protect, Prevent and Treat agenda integrates Prevent to be effective initiative for Stop Diarrhea initiatives. Now let us look at the cases of diarrhea. Cases of diarrhea are normally common and caused by a range of factors. It is very difficult to keep track of living conditions, the practices adopted by various communities and their lifestyle, which leads to increase in diarrhea cases. To tackle such situations, one has to consider multiple factors, and measures should be implemented as a part of an integrated package of effective, feasible and affordable interventions for child survival and targeting the most vulnerable populations. WASH is focusing on the development of life skills and the mobilization and involvement of parents, communities, governments and institutions to work together to improve water, sanitation and hygiene conditions. There are many approaches based on differing cultural insights, environmental and social realities. People living in poor conditions, inadequate social status, and lack of education and health-related communication initiates various WASH programs to deal with better living condition. Maintainable safe water supply points, including safe source, distribution, and point of use, hand washing stands and sanitation facilities. Integrated life skills education, focusing on key hygiene activities for children, and using participatory communication techniques. Reaching out the families, local, and the wider community for effective communication. Access to safe drinking water plays the biggest role in diarrhea control. Following 3 points are critical in the fight against diarrhea and improving health-related issues. Providing safe drinking water with microbial, chemical, and physical characteristics that meet guidelines for drinking water quality and access to safe drinking water. Make sure the water source is available less than 1 kilometer away from its place of use and make arrangements to supply at least 20 liters per member per day. Further, families, schools, communities should collect water from the cleanest available source. Saving and protecting the clean water source is a key responsibility of every individual, which helps to control the diarrhea. Access to clean drinking water helps to maintain a healthy life among the community. To protect clean water source, one should not allow bathing and washing near the water source. Avoid disposal of child feces in open ground and don't allow child for open defecation. This will lead to water pollution and spreads diseases. Safe disposal of children's feces is a major challenge. Higher rates of unsafe child feces disposal were found in poor rural areas. Even young children and household members defecate in the open space. There is a common belief that children's feces are not harmful, but exposure to children's feces could be more risky than exposure to adult feces. So, how to manage the safe disposal of a child feces? The safest way to dispose of a child feces is to help the child to use a toilet or latrine. If not, collect and rinse their feces into a toilet or latrine with the water flush method. Construct latrines away from the main water sources. If the latrine pit is near to the main water source, then there is a possibility of contamination. Keep animals away from the protected water sources. As a consequence, many drinking water sources became contaminated, making water purification measures indispensable. Collect and store water in clean containers. Empty and rinse out the containers every day to avoid the fungal infections. However, it is advised to use a closed container to store the water. Keep the storage container covered and take out water with a long handle ladle that is kept especially for the purpose so that your hands do not touch the water. Use filtered and boiled water for drinking. Water filters can remove contaminants, and it is recommended that doing both activities as boiling water and purifying may offer the greatest amount of protection. As of now, we have seen effective ways of water storage and accessing. Proper planning and management of water can bring healthier life to the society. In addition to traditional methods, water treatment devices are implemented in the household and community level to support and maintain hygiene conditions. Sanitation generally refers to the provision of facilities and services for the safe disposal of human and animal urine and feces. Commencing maintenance of hygienic conditions through services such as garbage collection and wastewater disposal. This is possible only when we use improved sanitation method. Sanitation is the hygienic means of encouraging health through prevention of human contact with the possibilities of wastes, as well as the treatment and proper disposal of sewage or wastewater. Waste that can cause health problems for human and animals are solid wastes, domestic wastewater, industrial wastes, and agricultural wastes. Better sanitation facility is defined as one that hygienically separates human excreta from human contact. Improved sanitation refers to the management of human feces at the household level. Using flush or pour water toilet gives better facility to maintain hygiene standard. This can be achieved through installation of the piped sewerage system, septic tank, closed pit, and better ventilated space. Next, we will discuss better hygienic factors. Hygiene is a set of practices performed for the protection of health. According to the World Health Organization, hygiene refers to conditions and practices that help to maintain health and prevent the spread of diseases. This is possible with regular bathing, washing vegetables before cooking, drinking water regularly, preserving drinking water, and washing the hands. Hand washing or hand hygiene is the process of cleaning one's hands with or without the use of water, or a sanitizer liquid, or with the use of soap for the purpose of removing soil, dirt, and bacteria. Wash your hands to prevent the spread of viral diarrhea. Hand washing more than 6 times a day with soap, water, and sanitizer is considered to be the basic hygiene standard adopted by the Global Hygiene Council. Hand washing as practice needs to be taught from a very early age so that school children adopt the practice and continue to use it as they grow, along with influencing others to do so. Hand washing regularly helps eliminate the chances of contamination through these methods. Make a habit of regular hand washing with soap after using the toilet or changing nappies, while preparing food, before and after eating food, after using a tissue or handkerchief, before attending to sick children or family member, and after playing with pets. There are many ways that germs and bacteria roam around and spread in our environment. Hand wash plays the perfect enemy of germs, keeping diseases like diarrhea outside. The ways germs spread include after playing outside, after using the bathroom and toilet, before eating or preparing food, after touching pet animals, before and after visiting a sick relative or friend, and after blowing our nose or coughing. Nutrition is a science that understands the interface of nutrients and other substances in food in relation to maintenance, growth, reproduction, and health of a child. It includes food intake, absorption, assimilation, biosynthesis, catabolism, and excretion. Malnutrition is a condition that results from eating a diet in which nutrients are either not enough or are too much, such that the diet causes health problems. This is one of the reasons for diarrhea, which may be a cause of undernutrition and also a consequence of undernutrition. Undernutrition in children is a major public health problem in India. Undernutrition increases the risk of illness and death associated with the illness. It also leads to compromised growth, impaired psychosocial and intellectual development in children, thus preventing children from attaining their fullest potential. In addition to poor nutrition, we have to consider key practices to prevent undernutrition in children. This is possible with early initiation of breastfeeding, that is immediately after the birth of a child, preferably within 1 hour. Exclusive breastfeeding for the first 6 months of life, that is 180 days. No other foods or fluids, not even water, but allows infant to receive ORS, drops, syrup with vitamins, minerals, and medicines when required. Timely introduction of complementary feeding, solid, semi-solid, or soft foods. After the age of 6 months, that is 180 days. Appropriate complementary feeding should be given for the children from 6 months to 23 months while continuing breastfeeding. Continuous feeding for children during and after illness. The mother's group is advised to continue the breastfeeding for 2 years or more than 2 years. In addition to breastfeeding, children should be supplemented with multiple food items as stated here. Along with the breastfeeding and other food supplements, children should undergo with necessary vaccination as prescribed by the National Immunization Schedule. The virus reduces immunity in children who have had measles, especially those who are undernourished, may die from pneumonia and diarrhea. Vaccination against measles and rotavirus becomes an important strategy for prevention against diarrhea. These are the factors which affect effective immunization and hence difficult to cover the children from regular vaccination. Difficult to reach remote areas, inadequate infrastructure, manpower and communication, faults in vaccine storage, transport and cold chains, and defective surveillance activities. Importance of vaccination. According to the recommended immunization schedule, for 1 month old to 6 years of age, children may receive up to 12 vaccinations to protect them from various diseases. Vaccination protects children from serious illness and complications of vaccine-preventable diseases, which can include non-functioning of an arm or leg, paralysis of limbs, hearing loss, convulsions, brain damage, and death. If children are not vaccinated, they can spread disease to other children who are too young to be vaccinated or to people with weakened immune systems. All vaccines undergo long and careful review by scientists, doctors, and the federal government to make sure they are safe. Every health worker should commit to our communities to protect each other and each other's children by spreading awareness on vaccination and its importance to the local family and community members. Measures for prevention of diarrheal diseases include the use of safe drinking water, hand washing, food safety, safe disposal of excreta, promoting exclusive breastfeeding, micronutrient supplementation, and immunization against measles and rotavirus. Lack of toilets and its use remains one of the leading causes of illness and death among children, and also safe disposal of child excreta. Yet, the greatest challenge remains in sustainable use of sanitation facilities rather than construction of infrastructure. As per Management of Diarrhea Committee, Ministry of Health and Family Welfare, Government of India recommends low osmolarity oral rehydration salt solution, ORS, zinc, and continued feeding of energy-dense feeds in addition to breastfeeding. Knowledge of ORS or ORT among mothers of under 5 children in India is good, 73%. But there is a big gap between knowledge and practice, as reflected in poor ORS usage rates, 43%. Low coverage of zinc prescription has been documented due to lack of knowledge and awareness among the care providers. Compliance with the use of zinc for 14 days and scaling up of zinc use in communities need to be assessed.